Our work in the arena of physical shalom touches a few different aspects of life in the village, promoting water and sanitation, child health and nutrition, combating malaria and tuberculosis, and promoting safe motherhood. These are all different components that have different activities at different times, but one of the major things that we focus on is HIV and AIDS. As many people are aware, but many people are unaware, AIDS is one of the major killers of people across Africa, sub-Saharan Africa, accounting for 70% of all of the HIV cases worldwide. Worldwide, there are 5,700 people who die every single day from the disease, and the infection rate in the area where we live is somewhere between 13 and 15%. The impact of AIDS on the community is extremely tangible. We put 2 more people in the ground just before we started taping this due to AIDS-related illnesses and opportunistic infections that swept in, took over people's lives, and that was it. The impact on families is extremely devastating when breadwinners of families are taken away. Mothers are left to raise children by themselves, or fathers are left to raise children by themselves. One parent must then find the resources to take care of all of the food, all of the clothing, all the schooling for all of the children. And in many cases we have a lot of orphans who are orphaned because both mom and dad have passed away, both because of the same disease. So the impact is felt on so many different levels. Our partnership with the community in fighting the epidemic of HIV and AIDS takes on a few different forms within the community. We do a lot of organization and capacity building in order to see more counseling and testing throughout the catchment area so that more people can know their status. We ferry blood samples back and forth to the lab so that people are able to check their immunity levels throughout the progression of the disease in their body. And perhaps most importantly and most significantly for us is that we do provide nutritional support to as many people as possible who are already taking ARV medicines to combat the virus within their body. Everything that we grow on the farm goes to home-based care, which then delivers it to a list of clients, all of whom are either HIV positive or have TB or some combination of the two, with a handful of chronically ill patients as well. Having that nutritional support is so important, one, because it strengthens their body, makes it more possible for them to literally stomach these medicines, but also it's extremely important for people just to know that there is assistance, that there is hope, that knowing that you're HIV positive does not mean that life is over, that you necessarily are going to die immediately. And so it introduces positive thinking, the chance for positive living into that environment. And for a lot of people, that's the difference between pretending that they don't have HIV and thereby spreading it to many other people, or really taking control of their own health and being able to say, best foot forward, let's do this. I'm going to live the life that I've been given to the best of my ability. And for a lot of people that means an awful lot. How many clients that you yourself visit?
Myself, I do this with the 18 clients.
Okay. And have you seen an improvement in any of their health?
So there is so much improvement to my clients.
Okay.
Some before we start this program, they were just nearly up to that. By this time they are peaking and they are looking very, very healthy.
Okay. What kind of problems do a lot of the clients have with their health?
They have HIV and AIDS, then some are TB. But according to these people, their sisters, what they are doing, they are keeping up.
So when a person has HIV, what kind of other problems do they have with their health?
They lack nutrition, They don't have proper nutrition. Once somebody is in with HIV positive, they should have to have a proper nutrition. But before they were lacking. But through the work of these people, Jane and the white, they receive some nutrition.
Okay.
And this time they are looking very fat and very fine.
Ba HPC kwena bale bomba elio ukubomba kwabo kupitila muri imwebene kwena bala kwata ukwisa mukula tupempula leo nokula tuletela ko ifya kula fintu mutwafuitisha chistayo sibalesa mukula tupempula limo ngata ukwete inshita yako ya mukukoka umuti kuti waisa mweva HPC kuti aisa yapo hospital aisa kuletela we client nena n'umuti. Starting with the HBC, former clients bonse tuli abatotela pakalamba sana kuli mwe ba provider ba Jeremy na ba Bethany nga abantu bamo ababa mu HCC edo nolubali ulwakwafuako fwe bantu abalanda kubana besu bonse fya bali kunchende kuno ukulaya ku kumasukulu echo imibombere ya msango yo ba Bethany na ba Jeremy ifwe numba tule mitotela pakalamba sana neshina na tumichinja nomba tule mitafyati ni misi na Mr. Suffering people efe tule mita ni bamayo na batata abantu abaleta shani abalesunga abantu ukututangata bwino